Hello everyone, this is the video about 10 things which Indian women should know before their delivery, especially the expectant mothers who are wondering about different things, different questions which come across their mind and they have no clue or no answers to. So, I have tried to make a list of certain things which we are not aware about. I'm also an expecting mother. I'm in the 6th month of pregnancy. So searching on internet and coming across certain YouTube videos, I decided to provide this information which might seem helpful to you, which might give you an overview before delivery, that what are the essential things that you should know. So here we begin. Okay, the first very basic question that comes to your mind is that are husbands or mother of the girl, mother of the patient allowed to the labor room? So generally we have seen in movies that they do allow a person inside the delivery room who can wear that scrub. Usually we have seen in some movies that husband is always there with the with his wife, with the mother when the delivery process happens. However, in case of India, it is not possible because doctors do not allow husbands inside the delivery room when the labor starts, and when you are about to deliver the baby, doctor and nurses will be there to provide support to assist you. There will be a team there, but you cannot take your husband. However, based on certain circumstances, like if you need a moral support and if you compulsory need some family member, you can request it beforehand, and then they might allow someone. Generally it is not okay. So the second question, like, which is very common, is how to manage the pain during pregnancy. We see different forms of exercises, yoga, breathing exercises to endure the pain. However, are there any rigid solution to that pain? So yes, in India, doctors do provide epidurals for the pain management. Epidurals act as anesthetics. They will help you for the normal delivery, and it will ease the pain. So most of the girls these days and most of the expecting mothers these days, they undergo this option. Doctors will ask you to choose that whether you want to go for normal process or whether you want pain management. So you can always opt for pain management using epidurals. They are completely safe and they do not harm the delivery process. You will have normal labor, normal delivery, but you will have reduction, decrease, decline in the pain. Okay, so this is a very silly question which comes to our mind, that who does the delivery, nurse or the doctor? Because we have seen that mostly nurses are moreover involved in such practices. So the answer is doctors do the delivery, doctors perform the procedure. Nurses are there to assist and to provide other support that a doctor needs, a mother needs, but the procedure will be done by the doctor. So at least we can be assured that doctor is present and doctor will complete the procedure. Okay, now after the delivery of the baby, after the pain, after the contractions, we really do not know about the delivery of placenta. After the delivery of the baby, it is understood by us that the delivery process is now over. However, a significant part of it is remaining until you deliver the placenta. Now placenta is an important organ which is specially formed in the mother's womb in a female body during pregnancy to provide all the nutrients and essential requirements to the baby during all 9 months of the pregnancy. So, placenta has to be excreted. Until and unless the placenta is not excreted, your delivery process is not over. So, once you have delivered the baby, the placenta follows the same path, and you will continue having contractions. The pain of the contractions will be slightly lesser than the contractions of delivering a baby. However, you will have contractions. So after that contractions, you deliver the placenta, and then your delivery process is finally over once you have delivered both baby and the placenta. Okay. Now the other question which comes across and which is really important is, like, if I have past weeks due date from the weeks of my pregnancy, now what to do? I'm not having any labor pain and they really get anxious. So is there any solution? Are there any solutions to that? Luckily, yes, there is a solution. In India, doctors do provide pitokin injection. Now what is pitokin? The word itself is confusing. Pitokin is an we can say that pitokin is a synthetic form of hormone, that is of oxytocin. Now what is oxytocin? Oxytocin is a natural hormone which is produced in the human body by touch, or by a good feeling, by human handshake, by hug, when your loved one hugs you, or when we cuddle the baby, or when we cuddle our pet, oxytocin hormone is produced. That hormone is also known as love hormone. Now, synthetic form of that hormone is given intravenously, that is by injection. Small doses are given, and then doctors increase the doses as per the need, and it will help you to induce labor. It will help you to have a natural labor. So, I don't know whether your doctor opts for it or not. So you must always ask these questions to your doctor before the due date. Once you are in the 36th week, or once you are in the ninth month of your pregnancy, make a list of these questions and ask to your doctor that which procedure they follow, how they follow, what if this happens, what if this might not happen. So always keep a handy list of these questions, which will really help you during the delivery process, because at that time you might not be aware of these things, and whatever your doctor says, you listen to that, and you'll wonder what is this, what is that. So it is important to know, to have some information about that. Okay. So what centimeter, now the next thing, what centimeter the cervix is dilated when a baby is ready to come out, when a mother is ready to deliver a baby. So cervix starts to dilate from zero point 0.5 to zero point 0.7 centimeter when initially you start having the labor pain, and it reaches till 10 centimeter, 9 to 10 centimeter, until you deliver the baby. Now the question is, what is the pain? What amount of pain? So the amount of pain which you experience during your period is 10 times lesser during the period. So to explain it easily, when you are in your menstrual cycle, the cervix is dilated at 1 centimeter, and you feel the pain that we all know and which we all come across every month, right? So until the cervix comes at 10 centimeters, so 10 times increase, tenfold increase in the pain, and then you deliver the baby. So yes, it is of course difficult, and you need lots of strength and stamina to understand this pain, to tolerate this pain. So ask your doctor about these questions, about the pain tolerance, what to do when the labor pain starts, how to manage the labor pain. But it is like approximately 9 to 10 centimeters, starts from zero point 0.5 to zero point 0.7 centimeter, and then slowly based on the contraction. For instance, if the pain has started in the night, you'll be ready for the delivery in the morning. So it might take 10 to 12 hours, or maybe lesser time. It always depends. But if it is 1 centimeter at night, it will take till the morning for the cervix to be completely open to deliver the baby safely. Now, the next question, which is very common and which you might know or which you might not know, is what is the average stay in hospital after the delivery? Some some people say that 1 or 2 days, but it always depends on your doctor, and it depends on the delivery process that you undergo. Generally, yes, it is 48 hours. However, it depends that if your doctor needs to observe you, or if there are any complications, it might increase up to 1 week. 1 week or 5 days is the maximum period. But generally, if you are delivering the baby normally, or if you are delivering it via C-section, you can go home within 2 days after the delivery. So that is 48 hours of period. So yes, these are some things which you should know before the delivery as a mother, which you should understand and you should research about. Thank you so much. I hope this video really helps you to comprehend some things which you haven't came across during the process of pregnancy. So yeah, thank you so much. Have a nice day.